I'll go through how to utilize custom fields, templates, and SOAP notes. So in Azalea Health, office overview to arrive the patient, move them into waiting, and move them into the exam room. Once they're moved into the exam room, that's easy access to the chart. And once you click in the chart, it brings up the SOAP note. So Azalea Health's chart is a basic SOAP note. If I click Edit here, I start out with the chief complaint. When I first come into Edit, I'm in red. I have my templates on the left-hand side. Templates can consist of multiple custom fields, procedure codes, diagnosis codes, and a lot more options that we'll go into. So I just want to give you a brief overview of this SOAP note. If I collapse it here, you'll see it's Subjective Objective Assessment Procedure Plan, any documents, comments, and there's a HIPAA log in there. So for template reasons, you want to keep them as simple as possible, but I'll show you all the options that you have. If you click in Settings here, click on the Medical tab, you'll have Chart Custom Fields, Chart Notes, and Chart Templates. Chart Custom Fields are fields that you can build that you can apply in certain areas of the software. So for instance, here's the areas Subjective Objective Plan Assessment Procedures and Chart Summary. So if you wanted an additional field called, I guess, Review of Systems, you could put it in the subjective area and title it Review of Systems. You have a field copy settings here. This means if it's set to do not copy, when that patient comes in the first time and you use this field, if they come into the second time, it does not automatically copy over. But there are some additional options. If you pull in this field and you want it to copy the field, you can select this option. If you want it to copy the values, it means that any changes that you make in that chart, it will copy those changes over to the next one. So for instance, if you had a normal review of systems on a patient and you edited it to be abnormal for the ears, if you had it copy values, then on that next visit, that same exact edits that you had would come over. I want to remind everyone, while I'm thinking about it, that there is the ability to submit questions. Just look on the right-hand side of while you're logged in, and you'll see the ability to submit questions. So at any time, if you have any questions for me, please submit that question, and I'll stop and try to answer it. Or at the very end, we can go through any questions that anyone has. So to get back here, so the area is you have these options, and then automatically add is another setting. This would be a field that you would want to automatically add to every chart. So if you wanted a certain field, let's just say review of systems, and you only had one review of systems, and you wanted it added to every single chart, so you wouldn't have to tie it to a template, you can click automatically add. Form editable in chart is another option here, but you see it's grayed out. So as we go through and start building some things with the editor, you'll see that this will become available if we use any form elements. So to begin with, I'm going to point out a few. For the chart custom field editor, you'll also see the same editor in the other areas of the templates. So there are a few things. This is a checkbox feature. So if you wanted to build a checkbox action, you can just click on the checkbox and click OK and type in what you want to appear afterward. You have a radio button, so if you prefer that, you can do that. You have a text field. This will allow you to type next to this while you are in edit mode without having to edit the form. Now, something that you want to keep in mind is that if you didn't insert text areas or text fields and you clicked this form editable in chart, it would allow you to still type in things next to this. So I'll show you how that looks in the chart once we go to apply this. The next thing here is a drop-down box. So if you wanted to utilize a drop-down box, you just click on that, and you don't have to give it any type of name or value or size. And then your text are actually your options. So yes, If you wanted this selection box to be a yes or no question, you can click that and then add. So the last one you add here is going to be the default. So if I leave it like that, it will show no as my default. Now, if I wanted to change that and it to be blank, I can double click back on it and actually add a blank value. And then you'll see that that is blank. So again, you can build as many selections as you wanted to in that drop-down. You can insert an image. You can also, if you're going to build a big form, you want to definitely insert a table to keep everything in line. So just like in Excel, you'll have your rows and your columns, and then you can do your border size. So if you didn't want it to show up like a grid, but you just wanted to keep things in line, you could change that to 0 and it wouldn't show in a grid. So you can insert a table here, and then you can also insert, your values and stuff here. So if you wanted to do a full table with your check boxes and your options as a form, you could do that way. One of the other variables here is, you have your custom editor, your bold, your italics, your underline, but you also have your styles and sizes, but you have variables here. Patient variables, these are variables you can insert into these fields that will pull certain specific information. So if you wanted to make a custom field that always said, their name, first name, or there's one for actually full name, you can apply these variables here. This also applies to handouts. So all of these variables are available in your handouts, and again, that pulls the patient-specific information. Some of the ones you might use in the chart more is the medical variables. So within the chart, you have all of this information, but sometimes providers choose to add all of acute diagnoses or chronic diagnoses into their own field. And so you can do that by naming this chronic diagnoses, and having this variable pull in will always pull in those chronic diagnosis statuses to this field. And again, it just creates like another view for you if you prefer. And then we have scheduler variables as well and billing variables. So if you wanted to pull in the patient's balance, you can insert that variable and it will pull that patient-specific balance. You also have spell check in here, which is a great thing. So you can right-click and it will help you with your spelling. Then I'm just going to save this here, and we'll go into a couple other options. So again, chart custom fields allow you to customize beyond the SOAP note and apply these fields to the different areas. You can now take these chart custom fields and tie them to templates, or you have the ability to pull them into any chart, and I'll show you that option here. So when I click Save, now here are all my chart custom fields. So you have the field type. It can either be a form or text. Your text fields are going to be the ones that don't have any form elements. So like we discussed, if I look at this text field here, you can see it doesn't contain any of those checkboxes, drop-down selections. It's just a basic text field. And then you don't have the ability to do form editable in chart because it will be editable no matter what if it's a text field. So now let's go look at our chart templates. If I click on chart templates here and I click new template, now this follows the same thing that it does in the chart, but this gives you the ability to tie multiple custom fields and create specific templates based on your practice's needs. So for instance, I might do one called new patient visit, or I could do one as specific as strep throat. And then you can type in, like if you have a patient that comes in with a chief complaint of sore throat, or you might want to change that to sore because you haven't diagnosed them yet. So sore throat, and then the chief complaint is always sore throat. You might want to add in here to make it look a little more formal, patient variables. This is where those come into play. So I want the full name is here today and presents with the HPI, that's going to be very specific to your patient, so you might not want to put anything here. And then you get down to the subjective custom fields. Remember, we just built a custom field in the chart custom fields. Now this allows me to now tie that custom field to this template. So when I pull it in, it can pull in multiple custom fields. So I'm just going to select a random review of systems. But for this instance, since we're doing a sore throat, you might want to have a review of systems that's specific to what you check for people with sore throats. And then, so you might want to have a positive remark on one of these, since for sore throat there's redness always. So then we get down into our objective. Objective is usually where the provider's physical exam goes. Again, you can type in information here, but you have the plus field available to tie in any exam or any custom field that you've built elsewhere. So now I have two custom fields, and with a template it allows me to pull in both of those together. The assessment is, what you're diagnosing the patient with. So you have assessment fields as well. You can tie diagnoses specific to the templates. Now diagnoses, just keep in mind with ICD-10, you're going to need to be very, very specific with ICD-10 codes. So for your templates, you might not find it really relevant to add your diagnosis codes because they do need to be very specific based on the patient. But you do have that ability to tie certain diagnosis codes. For instance, for pediatrics, you might have well visit codes that you can add, the V codes that you can go ahead and add, so when you pull in that template, it always has that code. And then for your procedure codes, you can go ahead and tie a certain procedure code. If you basically, bill a 99212 for sore throats, you can go ahead and template that code, but you always have the ability to modify it while you're in the template itself. Plan notes, since this is specific to sore throat, you might want to go ahead and insert your sore throat plan. So if someone comes in with a sore throat, you might then diagnose them with strep, so you might want to have more templated SOAP notes that I'll show you that are specific once you diagnose them to pull in. And then you can click Save right there in the template. One other thing I want to show before we go to the chart itself and put this all in play is chart SOAP notes. These are your canned messages while you're charting that are going to appear on the left-hand side. These are very, very beneficial for providers to kind of build on. At the beginning, you might not have a lot that you can customize, but as you find yourself typing things over and over, these are your quick codes that you can use to kind of pull in that information to keep down on typing. So for instance, I'm going to show you a couple options here. For a chart SOAP note, I might prefer that I want a SOAP note instead of a custom field. So I might build a objective full physical exam for a female. So this is a full SOAP note that says physical exam complete female on the left-hand side, but then when I click on it, it pulls in all of this. Or I might choose to do a physical exam where I actually list out each area. So I might just have one for general, eyes, and constitutional, and so on. And now let's go into the chart because that's going to make it a lot easier for me to show you. So if I click back in my chart for Julie Lincoln that I created, again, when we first come into the chart, we have templates on the left-hand side. If you don't choose to use a template right away and you come in here and you type in the chief complaint, or you can see that this now reveals my chief complaint notes. These are your SOAP notes that I was just talking about. You can go ahead and type in something here. I'm just going to insert a SOAP note because that's easier. And when you save it, it will reveal your templates again. So if I decide at that point that I wanted to pull in a template for new patient visit, I can click on that template and I have two options. Merge is going to merge it into anything else I've already added to this chart. So you will want it, most of the time you're going to want to use merge. This feature also allows you to merge multiple templates together. So if you have very basic templates and you want to merge them together and make them more specific, or however it works for your practice, the merge feature is a very nice feature for that. But it also allows your staff members to go ahead and enter stuff into the chart, and by clicking merge, it will merge that information. For instance, vital signs. If they've already entered vital signs in the chart, you don't want your template merge to override it. So that's why the merge is important here. You'll want to use override only if you've inserted the wrong thing, basically. So this override action is going to override anything that has already been entered in that chart. So I'm going to click Merge. You can see that I already typed in did not go away, but it also pulled in the template that I created for a new patient visit template. One other thing I wanted to show you that is an option in charting is Dragon Dictation. So this is a service that you can use, and you're only charged if you use it. If you're interested in this feature, please reach out to our support team or your customer engagement representative, or you can reach out to me directly, and we can get you some more information on that. But you basically have this microphone that you can turn on speech dictation. And if I click on it here, you'll see that it will reveal a microphone down here. And I can click in the field, and I can click on this microphone here. Julie Lincoln is here today for a new patient visit. And there it dictated what I said there. So again, that is additional feature that you can utilize, and to turn it off, I can just click back here. So let us know if you'd like to use that. Again, you're only billed if you use it, and it's a per minute charge. And you can use it, you can also, if you have Dragon on your computer, you can easily dictate into Azalea Health in these fields. So now, if I click in the HPI, you can see that I also have subjective notes over here. So this is important to know the difference. Sorry, my Dragon's still turned on. Let me turn that off. All right. Sorry about that. I had to turn that off. Okay. So in your subjective, you have your subjective notes revealed. You can use your custom fields for these notes. So down here, I inserted a custom field tied to that template that pulled in once I pulled that template in. Or I can use custom notes to pull in a review of systems complete. And that will pull in all of the information that I typed in. So that's not really relevant in the HPI. You can have the ability, you have forms and you have text, so you can see the difference. I wanted you to see the difference between. So I inserted a review of systems that's normal here, but I can click in it easily and change anything or override anything that I needed to. So if the patient had a recent illness, you might say the patient had a recent illness, recent weight loss, and just edit anything that pertains to that patient specifically. So if you prefer forms, you can see here that this is a checkbox form. So up here it says negative unless otherwise specified below. So if they're having weakness, then you can just simply check that. You also have body diagrams that you can insert. So these are images and you can draw on things. You have your vital signs that you can add here, and you can add multiple vital signs. And then this is where in the physical exam, your provider might want to utilize objective notes, and it would allow them to pull in like a complete physical exam and have multiple. They can have one for female, one for male, one for diabetes, hypertension specific, or they might choose to list out their entire physical exam one by one. So I can pull it in there, but then the provider might want to just have, like if I do general, I can pull in general. If I do eyes, I could just have a note for eyes. If I do neck, I could have a note, one for neck. So again, SOAP notes can be used and customized for however you want to use them, but they are a nice tool to easily pull in information. I get down here to my assessment notes. I can easily type in here. Diagnosis codes. With ICD-10, we want to make sure we're being very, very specific. So you have a search field here, and you can do the essential hypertension, but you might want to, if you're diagnosing your patient with hypertension, you really want to drill down and make sure you're using the right code that's specific. And we'll cover this a little bit more in our November 16th webinar that we're going to do on meaningful use and MACRA that's coming up in 2017. Make sure you register for that. There's something called value-based modifier that will require, if you're doing the Medicare, that you use the most specific codes if possible. One thing I want to point out as well is that you'll see some red codes here. We've added this red alert just to let you know it is an unspecified code. You'll want to be really trying to shy away from those unspecified codes in your documentation and make sure you're using the most specified code possible. So I might search hypertension stable because I want to make sure that I get the most specific. That's probably not a diabetes. Type 2 diabetes. So make sure you're using the specific ones, and you can always use our search feature here. You also have the ability to build quick picks. So you can build multiple diagnosis quick picks and in the settings, and I'll show you that right quick. If you click on settings here and you click on general here, you have DX quick picks. You can create a quick pick, and that provider can then have access to those quick picks. So you might want to build one specifically for hypertension and then all of the options under hypertension. Again, you can use the search, or you might want to use a DX quick pick for anything that's specific to your practice that has the options easily available without using the search. Again, you can add multiple per provider. So if you had multiple here, I want to show you. If I go back to my chart and I click DX Quick Pick, it's going to give me an option to, sorry, I don't have multiple attached to this provider, but it would give me an option to choose which quick pick I want to see. So that is a good tool there. And if you have any questions about that, please reach out to our support team. We're always available. Your procedures, you can have notes on the side and you can have fields. Just remember, everywhere in this chart, you have your objective field plus button, you have your subjective field plus button. This is how you can pull in those custom fields that you built without tying them to a template, just as needed. So if I wanted to bring in, I guess, a questionnaire, or I might have a patient that I want to ask additional questions, and I build that as a custom field, I can click on that and bring it in any given time to that chart for me to ask those questions to. So there, that form was filled in, and that's specific to the patient. It might not be something I had as part of my template, but I wanted to pull it in at any given time. I get down to the procedure notes. You have your procedure codes you can type in here. You have your procedure quick pick, and you have your search as options. So you definitely have a few options here, and then you can search by name as well. Your plan fields, that's something that you might want to have. A lot of people create like a follow-up specific field. And this might want to be one of those settings for follow-up that you just have automatically add every time, so you don't have to tie it to every single template. But basically, it allows them to document when they need to return. But you also have your plan notes. And this is where I see the SOAP notes really used a lot more than any of the other areas, is for certain plans, for certain things you're going to advise the patients on, for certain things, create these quick notes over here. So if you diagnose your patient with strep, I might have a note over here that's titled strep. And this is what I typically always tell them to do for strep. Again, this will always be modified specifically to the patient if you need to add any more instructions here. At the bottom, you're going to electronically prescribe. I hope everyone is electronically prescribing by now. If you're not, that is an additional feature we're definitely would love to see you utilizing, and you can click and you can launch Azalea ERX here. You can add pharmacies, manage medications, and prescribe. But as soon as you come in here, you can see I've never added an allergy for this patient. So it's going to make me add an allergy before I can prescribe, because it definitely does those drug to allergy interaction checks. So I might say I'm allergic to aspirin, and then what's my reaction? And now that's going to be added to my record as well. And then I could go ahead and prescribe that prescription. Make sure your favorites list. It allows you to easily select, or I can always search. And I'm going to prescribe this patient with aspirin because I'm going to show you that it definitely does the allergy alert. So it lets me know that, hey, wait, she's allergic to aspirin. Do not prescribe her this. And that I would not recommend in prescribing anyways, but I'm just going to continue for ease of showing you. Take 1 tablet by mouth once a day as directed, and continue. And I got to specify a quantity. So I want 30. Continue. It's going to make me approve the prescription. At this point, this is where you can add it to favorites if you wanted to, so that you didn't have to go through that process again. You can just select from your favorites list and click OK. Now when I save and close, it's going to ask me for my signature password. So provider. Let's hope I have the right signature password, and I'm going to send it there, and it lets you know the prescription's been sent. Then when I save and close here, it's going to ask me to attach that prescription to the chart, and I click select. Orders, these are your lab orders. So if you're using in-house lab ordering, or if you're using an outside lab, I would definitely recommend interfacing with Azalea Health for your outside labs. Just reach out to our interface team if you're interested in us getting that process started for you, LabCorp, Quest, or any of your other lab companies you're placing orders to. This will make it easier so you have the ability to select the lab. We have a generic ordering that allows you to put in diagnosis code and test codes and then result those codes. I do want to let you know that currently it is only LOINC codes that you can order. So if I click plus test codes, most people aren't familiar with what LOINC is. In one of our very soon-to-be releases, we will have the ability for you to add regular CPT code orders so that you can use this for better in-house lab ordering. And then so that order would be attached there. And then I have a care plan field. The care plan fields you need to be using especially for referring to other provider. This is a meaningful use measure. So I select referral to other provider, and if I don't know the scheduled date or end date, you want to select the referring to provider, and this pulls from the list of providers that you have loaded as referring providers. But you can also add one at any given time there, and click save. Now, I didn't put much information in there, but that is a good place to document your referrals. And then you also have your recalls. Recalls are something that you can utilize that will allow you to basically keep track. If this is a yearly visit for Julie Lincoln and I want to recall in 1 year, this is a good way to go ahead and say that she needs let's just do a 6-month follow-up. And then that recall date would be 6 months from now. And click save. Now this is going to be documented here and in the patient's record under recalls. And then I'll show you how to run your recall list as well. Any additional SOAP notes you want to do here? Sometimes this is for the checkout people. They might come back in here and say when they made their follow-up appointment. Any documents you need to upload if you've taken a picture of something and you want to have it attached to the chart. You can click attach and upload from your computer, or you can drag and drop images that you have on your PC there. And then click save. You're done charting for the day. And at this point, the provider would either sign or come back later to finish anything. So I hope that made a good bit of sense for templates. There are a lot of capabilities for templates, but just think of it as a simple thing, and I'm going to go back through it one more time. You have your chart templates. Within your chart templates, you have the ability to tie multiple custom fields. You have the ability to template the certain areas that you want to pull in once you merge that template. You have the ability to also add CPT codes, add diagnosis codes, and so on. You have SOAP notes that you can build that are basically canned messages that will show in the different areas when you click on them in the chart. And then you have chart templates that you can tie it all together. And that's pretty much everything you need to know about templating and charts in Azalea Health. We have a good bit of time here. We have about, a good 15 minutes for any questions people might have. I'm going to give you a few minutes to submit a few questions, and I will be ready to answer them. I have one question coming in here. Do you have a template library? Yes, we do. Thank you for asking that question. That was something I meant to cover. Basically, and it's right here, if you click in Chart Templates, you have an option for Import from Library. If you click here, you can select a specialty. So let's just do allergy, and then you can preview the allergy infant screen. So if I preview that, have some information here on, it looks like an allergy infant screen, and then the results that are recorded. And let's just say that I want to import that template into my library. I can just click import. Then that template is available for me to use. One thing I want to make sure that everyone knows about is that once you add a template, you have to select which users have access to that template. So for the allergy infant screen, for instance, I have users on the left-hand side that I can grant to specifically, or I can add those users to groups, and this is the easiest way to manage your template permissions. You want to definitely add groups, and then if you add new users, make sure to add those users in the groups. So if you have a clinical staff and they need access to every single template, I would recommend going to Settings, General, Group, build a new group called Clinical, add all of your clinical staff members to that group, then give the permission in the template to the clinical staff, and then make sure that that clinical staff has access to the template. And let's just do a new one here. And then just make sure that they have front office access, and then save. That way, if I join the practice next week and someone adds me to that clinical group, I automatically get access to all of the templates that had that group. Also remember that SOAP notes are the same way. If I do a new note, it defaults to whoever's building it, but you want to give access to all your clinical staff, you can do that here, so that again your groups apply. But this does allow a certain provider or a certain user, if they want to just build their own information and not share it with anybody, they can build it and just leave their name as a specific user that can only see it. Does anybody else have any questions? I didn't touch on patient history fields, but these are different from templates because it allows you to build history fields, and then those history fields can actually be filled out in the medical history section before the patient comes in. And so you don't have to fill it out in the chart, whereas in the chart, the encounter custom fields and the chart custom fields and the chart SOAP notes can only be applied there. So if I fill out family history, now that history's saved there, and then any chart that I create going forward, it's going to always pull in that new history. So you can fill it out in the patient's record, so you can see that the family history is here. And then if I add for surgical history, for instance, that I got my tonsils out. And then if I save that, now in the medical history section here, you can see that that is now updated in this section as well. So that's a good tool. Your history fields are a good tool to utilize so that you can have your staff members filling out history here and then that applying to any charts created afterwards. And it doesn't go back and update any previously created charts because you wouldn't want that to happen because the history is true when that chart's created. A second here. I have a couple other questions coming in. Is there a fee to interface to LabCorp? That's a great question. So your labs will sometimes cover these fees for interfaces. So we do have a process outlined that we can send you that shows you the process for contacting LabCorp and how to reach out to them. Our support site is actually down right this second, and we're working with our vendor to get that back up and going. But we do have, if you go on our help site and search for LabCorp, it will give you the process. But basically for LabCorp and Quest and the labs, you reach out to LabCorp and tell them that you would like an interface with your vendor. Then they should get the correct people to then reach out to us. And LabCorp will let you know if you do enough lab ordering and resulting, they will cover the bi-directional cost for the interface, but they may only approve like results only. But it is worth it reaching out to your labs to see if they will interface with Azalea EHR. And you can give them the email address interfaces@azaleahealth.com to reach out to directly, or anybody at Azalea, and we will work with them. Lab will not cover the interface. There is also the ability for us to quote you. But most of the time, LabCorp does. If we already have Dragon on our computer, do you still charge for using it in the chart? No, there is no charge for using your PC-based Dragon. You can dictate in the chart with no additional fees. The Dragon that we have available is the web-based, so that would be the only time if you wanted us to activate the web-based. That would allow you to access it from anywhere, not just that PC. We can activate that for you, and it's a minute-by-minute charge. But honestly, I do recommend Dragon on the PC. If you already have it, you can use it in multiple places in Azalea. You can use it in handouts, you can use it in messages, you can use it in tasks, you can use it in the chart, whereas the Dragon web-based, you can just use it in the chart. Great question. Are there any videos or instructions I can watch about template building? Yes, we do have videos and instructions on our help site, and also the Azalea Academy course. In the admin course and in the clinical course and the provider course, you're going to have additional videos on those sections. So I would recommend, if you want in any way, again, it's a free resource that we can enroll you in those courses. And also, please make sure to check out our help site. If you click on support, it takes you to our help site, and it allows you to search for any topic. And most of the time, we have step-by-step and videos included in those results. Anybody else have any questions? Doesn't look like there are any other questions coming through. I was just going to give it a couple more minutes to see if anyone else has any other questions. There will be a copy of this webinar posted on our website and also on our help site. And I appreciate you all joining us today. Please stay tuned for more webinars to come. I think the next webinar is in, if I click here, on our login page, you'll have a Beyond the Basics you can click on. So free live training sessions, click here to discover more. It's going to take you here where you can sign up. The next one we have is Friday, November 4th, and it's all about billing and claim rules. That will be a good one to join if you're doing billing. If you're not using Azalea for billing, we'd love you to, so reach out to us and we can help you with that as well. And here's an ongoing schedule through the end of the year on what other webinars we'll be offering. If you have any advice, please reach out to us and let us know what would be another good topic for a webinar. We appreciate you all working with us and hope you have a happy Friday and great weekend. Thank you.